This is a normal kidney in the lower field, and in the upper field, it's a kidney with the disease we're going to talk about now called arterio and arteriolo sclerosis, also called nephrosclerosis, also called arterial and arteriolar nephrosclerosis. Let's compare it to the normal kidney. Here's a normal kidney. It has a very smooth cortex. A very smooth surface. There are abundant glomeruli in the cortex, none of which are hyalinized. The tubules are nice. There's not much scarring or inflammation within the cortex. This is a normal kidney. Before we look at the microscopic of the abnormal kidney, let's look at what it might look like grossly. The cortex is not smooth at all. Look, and perhaps in this area it's nice and smooth and shiny, but it gets to be generally very granular and appear very coarsely granular. And up here it's not only granular, it has these little pits, almost like little infarcts. Well, the reason why it's like this is because the arterioles and the arterioles are sclerotic, and therefore the kidney cortex does not get enough blood, and therefore it causes little infarcts. Let's take a look at the microscopic of this in a full screen form. Here's the cortex again, and the first thing you want to appreciate is the fact that look at this large blood vessel here, artery, and the large arteries here. They don't have much of a lumen, do they? You could barely see them. Up here it looks like they're about 90% thickened and occluded. Is this related to atherosclerosis? Well, in a way it is, but it's fairly specific for the kidney. Also note that many of the glomeruli, like here and here, are hyalinized. They're sclerosed, they're infarcted because they're not getting enough blood supply. Also noted that there is generally a good amount of inflammatory cells scattered throughout the kidney as well. And also notice the fact that this, here's a hyalinized glomerulus here. Also notice the fact that it's not only the large arteries that appear to be significantly thrombosed, but if we look at even some of the smaller arteries or the arterioles, I think we could probably use this as an example, for lack of a better one right now, that they have a pretty significant thickening of their wall. This disease is very, very, very common. It's present in almost every autopsy of an elderly person, no matter what they died from. And it results in progressive renal dysfunction. Often the person dies before the kidneys become in failure, and it is a common cause of hypertension. And that's all that I want to say. Here's kind of another thickened vessel here, isn't there? Thank you very much.